Good evening, everyone, and thank you for joining us for this very important webinar, Pregnancy and Immunity, Understanding the Role of Vaccination. My name is Mansi Khurana, and I'm the Vaccine and Benefits Coordinator with the Vaccine and Benefits Outreach Team at Hunger Free New York City. I'm pleased to be co-hosting this event with the Vaccine Literacy Campaign, a valuable partner of the campaign. First, I want to point out that we have live interpreter available, providing Spanish as well as English translation during this event. You can choose your preferred language channel by clicking on the interpretation icon at the bottom of the screen and checking off the correct language. You may wish to mute the original audio as well if you're listening to Spanish-only channel. The Vaccine and Literacy Campaign and Hunger Free NYC created this opportunity for convening to respond directly to the concerns and questions about how pregnancy impacts the immunity and what considerations are important for pregnant and breastfeeding people. We collected questions and concerns from pregnant people and an expert panel to speak on the specific topics people wanted to be talked about. We are grateful to have so many people join us this evening from all across New York City, and we thank you for your attendance. Two of you from the audience will have a chance to win a $50 Amazon gift card. So please stay until the very end. So once the raffle is drawn, you're here to know if you are the lucky one. We are fortunate to have esteemed panel here with us tonight to answer all your questions and share their guidance, and I will introduce them in a moment. Now I will pass to Philomena, Director of Community Organization at Hunger Free NYC.
Hi, good afternoon, and thank you for joining us. Thank you for joining us today on April 19, 2023. My name is Filomena Acevedo, and I'm the Director of Community Organizing with Hunger Free NYC, and I'm definitely happy to join today with all of you and join with CUNY University on the Vaccine Literacy Campaign today to bring this information to all of you on behalf of our low-income community that is needy. We had doctors, expertise, we had definite information for that they got their testimonial, and we also have staff from Hunger Free NYC that they're going to be speaking about the safety of the vaccine. Thank you for joining us today. Naji?
Hi, everyone. My name is Najara Mishkiri, and I am a Vaccine and Benefits Outreach Coordinator for Hunger Free NYC. I just want to introduce our organization and our team. So here at Hunger Free NYC, also Hunger Free America, our priority is working to enact the policies and programs needed to end domestic hunger and ensure that all Americans have sufficient access to nutritious food. With the rise of the pandemic, our team has added vaccine literacy to our mission. In addition to spreading information about programs like SNAP and WIC, we have worked towards spreading information about the COVID-19 vaccine to provide our communities the information they need to make the right decisions for themselves and their families. And with this, I would like to conclude with our motto, ending COVID, ending hunger lifts us all. Now I will pass it on to Helen.
Thank you, Naji. Hello, everyone. My name is Helen Baraki. I am one of Vaccine Benefit Coordinator at Hunger Free NYC. Thank you, everyone, for joining us. Mansi.
Thank you, everyone, for introducing yourself. And now Lauren is going to put a poll in the audience. So just make sure you see it on your end, on your screen. You will have few options to select from. You can pick whatever works the best for you. The poll is in English and Spanish as well. So you can select what option works the best for you. And I will give it one more minute just to see all our participants get to participate in the poll. And that's good. So 60% of our community here is here for some other reason. And I completely understand that. We are here to ask so many questions and get so many questions answered as well. So thank you so much. And now we are going to, let me just share the results of the poll as well. Okay, thank you. And now we'll move forward and we will introduce our esteemed panelist. So passing on to Helen.
Thank you, Mansi. And now, importantly, would like to bring our attention to our esteemed panelists who have kindly prepared presentation for us today. We will introduce each of our panelists with much abbreviated bios, because if I were to report their full achievement, then I wouldn't have any time left in the hour. Here with us today, we have Dr. Camille Clare, a board-certified OBGYN and a professor. And we have Dr. Chloe Teasdale, a professor and epidemiologist. Our first panelist is going to be Dr. Camille Clare. Like I said, she's a board-certified obstetrician and gynecologist who received her medical degree from Albert Einstein College of Medicine in the Bronx. She is currently chair and tenured professor at the Department of Obstetrics and Gynecology of Downstate Health Sciences University College of Medicine and a professor of health policy and management. Dr. Clare has held many leadership positions through her membership with the American College of Obstetrician and Gynecologist and National Medical Association. She was also an important panelist during a previous maternal health webinar, and we're so happy to have her with us again. Thank you, Dr. Clare.
Thank you for the invitation and the generous introduction. I appreciate that. So I guess we'll get started with our slides. So I'm going to hopefully provide some information about vaccination and pregnancy that will hopefully answer your questions, and some that have been provided ahead of time, and hopefully some that may come through from this discussion today. So myself and my colleague will hopefully help you make some decisions about what to do during the time of your pregnancy and after pregnancy regarding vaccination. So next slide, please. So what we're going to be talking about is what do we mean by immunity during pregnancy, what happens, what is the role of vaccination, and what vaccines we recommend. And I say we because as an obstetrician and gynecologist, as mentioned, I'm one of the individuals that are recommending vaccination for my patients. Next slide, please. So this is just a picture that kind of describes the process. So what happens is that moms, I'm going to use the term moms, it could be a gender neutral term, but a pregnant person or a birthing person is connected to her baby by what's called the placenta. That's where nutrients are spread from the pregnant person to the infant or baby inside during the pregnancy. And if someone gets an infection, that placenta can be damaged. And because the mom and baby are connected by the placenta, that damage to the placenta can affect the baby, as well as the mom's ability to fight off that infection. So what happens is that the mom produces what's called antibodies, which is a protein that the person makes that helps them fight off infection. That antibody is, as you can see from the picture on the right-hand side, the little blue areas can go in through the placenta. Those aren't antibodies, but the source of infection. And with the antibodies that a mom makes, the mom has the ability to fight off the infection in herself, as well as to protect her baby by antibodies that go from her to her baby through the placenta. And hopefully that'll be a little bit clearer as we continue to talk. So next slide, please. And so when should someone be vaccinated? So this slide says, for the most part, we usually recommend that definitely in the second trimester, which is about 13 weeks to 28 weeks, you can be vaccinated, but it really depends on the vaccine itself. So certain vaccines you can be given at any time during the pregnancy, and some are usually given at a particular time so that you're most protected closer to the time that you're going to give birth. And we'll talk about that as we go along. Next slide, please. So in this picture, we're talking about two particular vaccines that myself and my colleague are going to be talking to you about this evening. So one is the influenza vaccine or the flu vaccine, and the other one is called DTaP, which contains 3 vaccines. It contains protection against tetanus, protection against diphtheria, and the most important one in this case is against pertussis, which is called whooping cough. These conditions, flu and whooping cough, are very, very serious for pregnant persons. And so we really use vaccination during pregnancy to not only help keep you healthy, but also to protect your newborn, as I mentioned. The flu vaccine, we talked about when should vaccines be given. The flu vaccine can be given at any time during your pregnancy. And again, we want to give it mainly at a time when the flu is very rampant, which usually happens in the fall, sometime as early as September or October, all the way through. But again, it can be given at any time during the pregnancy. What happens when we give you a vaccine is the flu vaccine makes those antibodies, that's the protein that I talked to you about earlier. Those antibodies cross over to the baby through the placenta, and like according to that picture I showed you a couple of slides ago. And the baby is protected against flu, especially until the time when the baby after birth can receive their own vaccination, which for flu usually is around 6 months. So this is really an important protection, not only for the pregnant person, but also for the baby before they're able to receive vaccinations on their own. So the vaccine for whooping cough, or Tdap, is usually given between 27 weeks and 36 weeks of the pregnancy to protect you in the same way that vaccine creates those antibodies, which again are passed to the baby through that placenta and protecting the baby against whooping cough, because the baby usually receives its own vaccination after birth at about 2 months of age. So this allows the baby to get protection from the mom when the mom receives their own vaccination. The reason why we care about vaccines specifically for pregnant persons is that pregnant persons who get the flu in particular experience many more complications, can get much, much sicker than somebody who's not pregnant, and including many more visits to the hospital or to the doctor, many more opportunities to be hospitalized. And babies also have the highest risk of not only getting extremely sick from the flu, but also potentially getting very sick from whooping cough, including dying, especially babies that are younger than 3 months. So we already talked about babies cannot be vaccinated until they're 2 months. So by moms being or pregnant persons being vaccinated, that really, really helps protects babies. And we also know that vaccinations are safe in pregnancy. The type of vaccines that are given to pregnant persons are safe. They do not cause birth defects. They do not cause autism in children, and have been used to protect many millions and millions and millions of pregnant individuals throughout their pregnancy, not only protect themselves, but to protect their baby. Next slide, please. So when a mom gets the DTaP vaccine, that's the one for protection against pertussis or whooping cough, that can reduce the chance of their baby getting sick from pertussis by a lot, 91%. When moms or pregnant persons get the flu vaccine during their pregnancy, they're able to reduce their baby's chance of getting the flu by 70%. So really, really important to know that those 2 vaccines, as well as some others, but we're mostly focusing on these 2 and one more, are really important during pregnancy. Next slide, please. So we already talked about the timing. So when somebody receives a vaccine, approximately 2 weeks after they get the vaccine, that person produces those antibodies or makes those antibodies. Specifically, we talked about flu, we talked about the whooping cough, which again enters the placenta and is transferred to the baby. So when the baby's born, the baby has those antibodies that they've received from their pregnant person or their mom to protect them in the first few months of life, which is really, really critical when they cannot receive certain vaccines themselves. Next slide, please. So what about COVID-19? I've spoken a lot to many, many individuals regarding the importance of being vaccinated to protect against COVID-19 infection, especially for pregnant persons, for persons that are thinking about becoming pregnant, and for persons that have recently delivered or are breastfeeding or chest feeding. So this is really, really important because COVID has extreme, huge implications for those that are pregnant. Next slide, please. So what do we mean by this? The COVID vaccination is very safe during pregnancy. My colleague in a little while will explain a little bit more some of the details. The reason why we really think about vaccination in pregnant people is that now that we've had the vaccine around for several years, we know that individuals or people that have been vaccinated when they're pregnant compared to people that have not obtained the vaccination when they're pregnant really do better. COVID-19, the infection can cause a lot of problems, not only for pregnant people, but also for their babies. The most common things are death. Pregnant persons that have not been vaccinated from against COVID-19 are more likely to die from the infection. They're more likely to be admitted to the hospital in the intensive care unit. They're more likely to be on what's called mechanical ventilation or a tube inside their lungs to help them breathe. And they're also risk of complications to their babies. Their babies are more likely to be born early or premature. These babies are more likely to be admitted to the neonatal intensive care unit. These moms are more likely to again experience delivering early because they get so sick because of COVID that their babies need to be born early. But what are the things that cannot happen? These individuals have not been shown to have a higher chance of having a cesarean birth. They have not had a higher chance of bleeding during their delivery, and they have not had a higher chance of getting an infection that involves the placenta. Next slide, please. So again, the best time to be vaccinated specifically for COVID-19 is any time during the pregnancy. There has been no added risk when you're pregnant to get vaccinated against COVID-19. No complications for your pregnancy if you are vaccinated. So it's really important. Now's the best time. Also, if you plan to breastfeed your baby or chest feed your baby, again, you're also giving that baby through those antibodies that we mentioned an added protection, either through breast milk or through the placenta, as we mentioned. Next slide, please. So what are some other things you can do? We're here to mainly talk about the importance of vaccination. Vaccination in this throughout almost centuries or many, many years of us knowing about all types of vaccination has really helped us, has really eliminated some of the severe illness that used to lead to people dying hundreds of years ago. But in addition to getting vaccinated, other things you can do to help with your immune system is getting appropriate rest, especially during your pregnancy as best you can, including around 7 to 9 hours of sleep. Quality sleep is important. Staying hydrated, especially during pregnancy, drinking at least 8 to 10 glasses of water per day, if not more. Becoming physically active with the approval of your doctor, making sure that it's safe for you to exercise during pregnancy. But once you have a conversation with your doctor that says that you're okay, or your midwife or your obstetrical provider, it's good to exercise about 30 minutes per day, at least for 5 days of the week. And walking is a great source of exercise to, again, build up your immunity as well. Doing perinatal yoga is important to cause relaxation. There are classes that you can access and find out about. Again, once you speak to your doctor to make sure that those things are safe for you to do so during your pregnancy, and your pregnancy is not high risk, that can preclude you or not allow you to do some of these activities. And then meditation. In this world that we have a lot of stressors in our families, stressors at work, stressors at home, meditation, or really centering ourselves, centering our minds, all of those things. And of course, consuming healthy diets, healthy, safe diets are all important in boosting your immune system in general. Next slide, please. So this is just a chart that talks about the importance of certain vaccinations during pregnancy. We talked about influenza or flu, which is important to have in every one of your pregnancies. So suppose you say, Dr. Clare, well, I was pregnant 2 years ago and I got the flu vaccine then, and I'm pregnant now. Should I get the flu vaccine again? The answer to that is yes. Also with DTaP, it's important to have it every single pregnancy. So same thing. You were pregnant 3 years ago and you're pregnant again now. Should you obtain the DTaP vaccine? The answer to that is yes. There are other vaccines that may be given to other certain individuals depending on your medical conditions and with a conversation with your doctor. We won't talk about some of those other ones like hepatitis A or B or pneumococcal vaccine or meningococcal vaccine. But again, those are conversations you can talk to your doctor to find out, are those important for you because of what's going on in your own individual health. Some of the vaccinations that we do not give in pregnancy that are not safe include a vaccination for measles, mumps, and rubella. Those are not given during the time of pregnancy, as well as varicella, which is chickenpox. So those are not given during the time of pregnancy. What about if you plan to breastfeed or you plan to chest feed during the pregnancy? All of the vaccines listed here, flu, DTaP, all of those are safe to give for individuals that plan to breastfeed during their pregnancy and also after they've given birth. So again, those are important conversations to have with your doctor about which vaccinations are important for you, in addition to the ones we talked about, which is COVID, flu, and DTaP. Next slide, please. So I will end there, and hopefully our colleague will give you some more information, and we'll be happy to answer any questions. If anything is not clear from what I mentioned during this presentation, we hopefully will get answers to you throughout this talk tonight. So thank you again for the opportunity to speak to you about the importance of vaccinating yourself against flu, against COVID, as well as against DTaP. Thank you.
Thank you so much for your wonderful presentation, Dr. Clare. It was very insightful. Now we'll hear from Dr. Chloe Teasdale, a professor and epidemiologist. Dr. Teasdale currently is an assistant professor in the Department of Epidemiology and Biostatics at the CUNY Graduate School of Public Health. Her research interest includes maternal child health, adolescent health, global health, infectious disease, and reproductive health. She has also conducted research on the impact of COVID-19 epidemic on pediatric population, including studies on COVID-19 vaccine hesitancy among parents in the US and New York City. We have been lucky enough to work with Professor Teasdale on previous parent-focused webinar as well. We appreciate you being here with us, Dr. Teasdale.
Thank you so much. It's great to be back. Thank you for inviting me. You can go to the next slide. So actually, you can go to the next slide. So thank you, Dr. Clare, for that great overview of vaccination during pregnancy, how it works, why we need it. And what I'm going to do is talk a bit about the data that we have on the risks of flu and COVID-19 infections in pregnant women. I'm going to use that term, but it will also include pregnant people and birthing people, and also talk a bit about young children as well. So I'll be focusing on the data that we have that has informed why we give the guidance that we give around vaccination for pregnant women and pregnant people and children. I'll talk about the data that supports the benefits of influenza and COVID-19 vaccination, talk about safety a little bit, and then end with some current information about vaccination and boosters. Next slide, please. So influenza, as we all know it, the flu, right, is a virus, and there are actually two viruses that we think about with flu for the flu. There's influenza A and influenza B. They can both make us sick, and the vaccine provides protection against both of those, both types. Flu is endemic. What that means is that it follows a predictable pattern every year for the most part. As Dr. Clare said, our flu season starts usually in early October, and it actually lasts through May. So we're still in flu season for the current year. Usually flu vaccine peaks, meaning we have the most number of cases for the flu vaccine, for the flu season, excuse me. Our flu season peaks usually between December and February. What you're seeing over on the right are data from the New York City Department of Health. And what it's showing is the number of cases over the flu seasons going from 2018, the 2018-19 flu season through our current flu season, 2020-2023. And what stands out here, right, is that if you look at the light blue line in 2020 and 2021, that flu season, we actually didn't have much flu. And the reason for that, as you might imagine, is because we were following COVID-19 protection guidance, right? Most of us hopefully were wearing masks. We were not going to large gatherings. We were not traveling as much. So we didn't have very much flu in 2020, 2021. We had more last year. And this year, we've gotten back to what we would consider more a normal flu season, similar to the green line, the dark green line, and the dark blue line, which are our pre-COVID sort of normal flu seasons. You can see that this year, at least in New York City, and this is also true for the country, we peaked earlier. So the highest number of cases in the current flu season was in November and December of 2022, but we still have cases, and these are just the cases that are reported or people who get tested for the flu, whereas most of us who get the flu do not get tested, right? We have infection, but we don't actually, our case doesn't get reported. So this is the numbers here are much lower than the actual number of flu cases. You might have heard about what we call pandemic flu, and that occurs when something happens to the virus, it changes and it causes it to be much more infectious, meaning many more people get sick. And sometimes the flu season is also longer in those pandemic years. You may have heard about the 1918 flu pandemic. That was a global pandemic where many, many people got sick and died. The most recent pandemic year was 2009, where we had the H1N1 flu pandemic, and that also it wasn't nearly as bad as 1918, but it was many, many people got sick and many people got severely ill. Some facts about flu are that it comes from birds, mostly birds in some parts of Asia. And so in order to develop the vaccine every year, we actually, not myself, but people who create the vaccines go and study those birds in order to identify what vaccine is likely to circulate in the human population. And the flu vaccine was first developed in 1945. So it's different now. It's not exactly the same vaccine. And of course, every year it is slightly different to match the circulating virus, but it has been around for a very long time. Next slide, please. These are some data on our current flu epidemic this year, so our endemic flu of 2020-2023. And the number of cases is always estimated for flu. We don't know exactly how many people get the flu every year. And this is, like I said earlier, because most people don't actually go to their doctor and get a test for flu. Most people just, stay at home, hopefully, and don't get ill enough to go to the doctor and don't go to the hospital. So we have to estimate the number of people who get the flu. And we think that this year it may be as high as 50 million people getting the flu. Some of the data that we use to estimate this does come from testing. Some comes from doctor's visits. Some of it, very interestingly, comes from very innovative methods. So some of it is looking at what people are Googling, what people are searching for in search engines on the internet. And where we see lots of searches for symptoms, we also see lots of cases. So that's a way that what we call surveillance, or counting the number of cases, trying to measure that, is done. This is, if we have 50 million cases of flu, that's about 15% of the US population. So that's a lot of people getting the flu this year. We know that there have been somewhere between 12 and 24 million flu medical visits. So these are people, sick enough to go to the doctor or another medical provider to seek care. Almost somewhere around 600,000 or more people have been hospitalized for the flu. So these would be severe cases of the flu where people need acute medical care. And somewhere between probably 20 and 50,000 people have died and will die by the end of the flu season. So that's quite a large number of deaths from the flu. So the flu is very severe, and these are just data for the United States, and there are there are global data as well. Next slide, please. Now let's talk specifically about flu infection in pregnant women and children. And so as Dr. Clare already explained, pregnant women are more likely than other adults to get severely ill from flu infection. And this is why we worry about flu in pregnant people. We know that just in this year, so in November of 2022, when we were seeing the peak or the start of the peak of our current flu season, that almost half of all women between the ages of 15 and 49 who were hospitalized were also pregnant. This is a very high proportion of that population who were pregnant, and it suggests that, it shows us again that pregnant women are at high risk for having severe flu infections. As Dr. Clare explained, we know that flu is associated with poor pregnancy outcomes, so things we don't want to happen: pregnancy loss, preterm delivery, meaning premature delivery, low birth weight, death in infants, and also deaths in moms and other pregnant people. In 2009 and 2010, we know that about 12% of maternal deaths were due to influenza. This is a high proportion of deaths due to this cause. So this was, again, that was a pandemic flu year. It was a very bad flu, but we don't want pregnant women to be dying from anything, but definitely, we want to protect them from the flu. In children, we know that children are more likely than any other age group to get the flu. So any of us who are parents or who know children know why this is true, right? They have lots of exposure. They have touched lots of surfaces. They put lots of things in their mouths, and so children, due to this increased exposure, are more likely to get the flu. In fact, I told you earlier that around 15% of the whole population will get the flu. In children, it's double. So about 30% of kids in the US every year will get influenza or the flu, and about 20,000 will be hospitalized. So that means they have severe disease. And infants or young children who are less than 6 months of age are most likely to be hospitalized. And that's largely because when children who are very little get respiratory infections, their airways are small. And so their condition can become serious very quickly. And so we worry a lot about flu, especially in babies, in infants who are less than 6 months. That's also, as Dr. Clare noted, before they can get vaccinated, and so they are at very high risk for infection. In 2019, 2020, which again was our sort of last normal pre-pandemic, pre-COVID pandemic flu season, 188 children died from the flu. 43% of them were younger than the age of 5, and most of those were infants, were very young. And most of the kids who died from flu, or 57%, had no pre-existing conditions. And so what this tells us is that it's very hard to predict which children will get severe flu infections and can die from it. So we can't assume that just because a child is healthy and doesn't have a condition that puts them at risk for other health conditions, that they are less likely to get severe flu or to die from the flu. Next slide, please. Now I'm going to switch gears and talk about COVID-19 in pregnant women and children. We think we're all pretty familiar with when COVID-19 started, right? We had our epidemic starting in 2020, and it's still with us, unfortunately. So in pregnant women, as Dr. Clare already described, pregnant women are more likely to get severely ill from COVID-19 infection. As she pointed out, they have higher rates of hospitalization than adults who are not pregnant. The same pregnancy complications can occur, so loss, premature delivery, low birth weight in infants, infant death, and also maternal death. We know now, looking back since the start of the pandemic, that maternal deaths have increased. And in 2020 and 2021, a quarter of all maternal deaths were due to COVID-19 infection. This is This is a large portion of those maternal deaths, and it's very worrying that this is continuing. We also know that maternal deaths are not equally distributed, that there are large racial and ethnic disparities in who among pregnant women is most at risk for poor outcomes. And African-American women and Black women in the US have much higher mortality and much higher complication rates due to COVID-19. Next slide, please. COVID-19 in children can also cause severe disease. I think the messaging that we received early on in the pandemic was that children aren't at risk for COVID-19, or they just get asymptomatic infections, or even if they get sick, they don't get very sick. But the truth is that while children do tend to have milder cases of COVID-19 than adults, they can get severely ill from COVID-19, and many children in the US have had COVID-19. So about 15.5 million kids, it's probably higher than that. These are just kids who've tested positive, and as we all know, most testing now is not recorded for surveillance. It's mostly, most of us test at home for the most part, and so we're not actually getting the accurate picture of how many people are having COVID right now. But that's our best estimate of how many kids have had COVID. Just last week, 11,000 kids tested positive. Again, those are official numbers, that doesn't include home testing. We know that kids can get long COVID, and this is maybe something you've heard about in adults, where the symptoms of COVID or brain fog or fatigue or pain can last for a long time after a COVID infection. That can also happen in children, which is very concerning. And so for kids, the most common symptoms are mood symptoms, fatigue, sleep disorders, and these can go on for months. We know that around 190,000 children have been hospitalized in the US since the start of the COVID pandemic. And during the Omicron surge, which you'll remember started in December of 2021, around 20% of kids who were hospitalized were in the ICU, which is very serious. And there were some ICUs and pediatric ICUs in the United States where they ran out of room for kids. They didn't have any place to put kids who needed intensive medical care. And that was very concerning. There are also places in the United States where there aren't a lot of ICUs. We're fortunate in New York to have many wonderful hospitals, but that's a major concern. Another key finding around hospitalization for kids and COVID-19 is that half across the epidemic had no underlying conditions. So this is similar to what I was just saying about flu, which is that we really can't predict which children will end up with severe COVID. And so that's why we want to protect all kids from COVID. You can't assume that because a child is healthy and has no underlying conditions that they won't get severely ill. Unfortunately, more than 1,700 children in the US have died since the start of the pandemic. Around 40% of those have been less than 5 years of age. And the highest mortality, as you see over here on the left in this lower figure, the highest mortality rate is among children less than 1 year. And this is again because those children are vulnerable. If they're less than 6 months, they can't be vaccinated. And so we're very concerned about protecting that group of infants from COVID-19 infection. Next slide, please. So all that is scary, right? Those numbers are not reassuring. It's concerning that so many pregnant women and children are at high risk of flu and COVID-19 infection and disease and possibly mortality. So the good news is there's something we can do about it. We can protect ourselves, we can protect our children from flu and COVID-19 with vaccination. In 2019 and 2020, in that flu season just before COVID, flu vaccination prevented 7.5 million cases of flu, 105,000 flu-related hospitalizations, and 6,300 flu-related deaths. So the flu vaccine is very effective at protecting protecting the population from, and all of us as individuals, from getting sick with flu, from getting very ill, and from dying. The COVID-19 vaccine is also very effective. It is particularly effective at preventing severe illness and death. This is true for both the flu vaccine and the COVID-19 vaccine, even when they don't do a good job, or in the case of the COVID vaccine, have become less effective over time at preventing you from getting infected. They still do an incredible job of preventing severe illness and death, which is really what they're both designed to do. It's great when they prevent us from getting infected, but really their job as vaccines is to prevent us from getting severely ill and from dying. And the great news is they both continue to do that. Okay, next slide, please. Let's talk about flu vaccine for pregnant women specifically. And so for pregnant women who get the flu vaccine, or pregnant people who get the flu vaccine, they have 50% less risk of respiratory infections. They're less likely to be hospitalized, have preterm births, and low birth weight babies. We know that babies who are born to women who get, or pregnant people who get the flu vaccine during pregnancy have 34% less risk of flu infection. So we can actually protect infants who are too young to get vaccinated for flu from the flu by getting vaccinated during pregnancy. It's a twofer, right? It's a win-win. You get protection during your pregnancy, and your infant gets protected while they cannot be vaccinated themselves. Children who get the flu vaccine have huge reductions in severe and life-threatening influenza infections. They're much less likely to be admitted to the ICU. They're less likely to have to go to the emergency room due to flu, and they're much less likely to die from the flu. And note that 80 to 90%, it's usually around 90% of children who die from the flu each year are unvaccinated. So it's almost entirely children who are unvaccinated who unfortunately die from flu each year. And I just want to stress again that sometimes we hear that in a particular year that the flu vaccine that was created and is given out is not, quote unquote, well matched to the flu that's circulating. And that is true. That does happen, that when they go to Asia and they study the birds and they look around the world at places where they get the flu earlier than we do, and then create the vaccine, sometimes it's not a perfect match, and it's not, it doesn't have high effectiveness for preventing infection. But even when that occurs, those vaccines still provide very strong protection from severe disease and death. And again, that is really their main purpose. Next slide, please. COVID-19 vaccine, provides a lot of the same protection against COVID-19 disease. So for pregnant women, it's, lower risk of respiratory infections, less hospitalization, fewer preterm births, and low birth weight infants. Infants who are born to women who received COVID-19 vaccination during pregnancy have 45% lower risk of infection. These numbers on protection for infants have changed over the course of the epidemic as we've had different versions of the COVID-19, different variants of the COVID-19 virus. But even with our current variant, Omicron, there's still significant protection for infants when there's vaccination during pregnancy. And there's also a reduction in hospitalization in the first 6 months of life, when we definitely don't want to be taking our newborns to the hospital. We want them home with us. We don't want them hospitalized. So getting vaccinated during pregnancy can help prevent that. Kids who get the COVID-19 vaccine are protected from infection. So you may have heard misinformation that kids don't get any protection from infection from COVID-19 from the COVID-19 vaccine. That's absolutely not true. There is protection. It does wane over time, but the protection against severe illness and death stays very strong over time. So again, that's the main job of the vaccine, and it still does it very well. We know also that COVID-19 vaccination, both in adults and children, can prevent long COVID. So those who've been vaccinated and get infected are less likely to end up with long COVID. And we also know that 87% of kids who were hospitalized during the Omicron surge were unvaccinated. So we have much, much higher hospitalization rates among children who are unvaccinated. Next slide, please. Just a few notes about vaccine safety, and we'll talk about this a little more in the Q&A as well. Many studies and what we call surveillance data, right? The ongoing review of data that we're collecting on the population in the United States are very clear, and they indicate the safety of the flu vaccine. Millions of pregnant women have received this vaccine over almost 2 decades. And so we know that it is safe for pregnant women and pregnant people. The US has a system for reporting side effects to continuously monitor the safety of all vaccines, including flu, including COVID-19. And we know that pregnant women do not experience more side effects than other adults from either the flu or COVID-19 vaccines. COVID-19 vaccines have been given to millions of pregnant women around the world, and no harmful effects have been identified. And more than 13 million children 6 months to 11 years of age have been vaccinated. That's just in the US, that's not globally. And serious side effects are rarely reported. So we are confident that these vaccines are safe and they provide really important protection. Next slide. One last thing to consider is whether you need a COVID-19 vaccine or booster. So I mentioned earlier that the COVID pandemic is still with us, unfortunately. We are in a better place than we have been at many other points. We have fairly low infection rates in most parts of the country, some lower hospitalization rates than we've had, but there are still more than 100,000 new cases per week in the US. As I said, 11,000 cases in kids, and those are undercounts. We know that there are more than that. So COVID is still with us. And so if you or your children have not been vaccinated yet, or you haven't gotten at least one booster, you should get vaccinated, okay? And vaccination is available for everyone who is 6 months and older. There are certain small groups of people who cannot get vaccinated. You need to talk to your medical provider if you think that applies to you, but most people can get vaccinated for COVID-19. Anyone who's immunocompromised, including children 6 months to 4 years of age, should get boosted. This is the current guidelines or guidance from the Centers for Disease Control and Prevention, or CDC. The reason for this, right, is to prevent serious illness and to prevent long COVID. And again, as I've mentioned over and over, but I just want to say this again, that even when the virus keeps changing and we get different variants, and we see that protection from infection is waning over time from vaccination, we still get very strong protection from the vaccinations that we've gotten for serious illness, severe disease, and death. Okay, next slide. I just wanted to put in a little bit here because Dr. Clare covered it so well, the Tdap information. So this is just quickly some information about pertussis, or whooping cough. And that pertussis, again, it causes whooping cough. And in 2019, there were almost 19,000 cases of whooping cough reported in children. 41% of those cases were in infants 41% of infants less than 6 months who had whooping cough were hospitalized. So it's a very, very high hospitalization rate. And most of the children who got pertussis in that year who were of age to be vaccinated, so between 6 and 4 years, most of them, the vast majority of them, were unvaccinated, okay? What you're seeing here in this figure is the incidence of pertussis by age group. And you can see it's most common among infants, so those less than 1 year. And remember, Dr. Clare informed us that infants cannot be vaccinated until they're 2 months old, and they're not fully vaccinated for some months after that. It's a series, you have to get a couple vaccines. And what we also see in this figure is that pertussis or whooping cough has increased in older groups of kids. And the reason for that is that vaccination coverage has gone down. And this is really unfortunate because whooping cough can be very serious, particularly for young infants. And we need high vaccination coverage, not only in children, but also in adults to protect the children who cannot get vaccinated, very young infants. So the Tdap vaccine, as Dr. Clare explained, is highly effective in preventing pertussis infection in infants in that first 2 months of life when they cannot be vaccinated. And then it actually protects them from hospitalization over the whole first year of their life. Next slide. And that's it. Thank you very much. I look forward to talking about questions.
Thank you, Dr. Clare and Professor Teasdale. Now we will hear some testimonial videos from our community members who received vaccination during pregnancy.
Hola, mi nombre es Ana Zadorian, trabajo para la organización Hunger Free NYC y yo quiero invitarle a que hablen con su tutor sobre la vacuna contra el virus COVID-19. Antes de decidir vacunarme tenía muchas preguntas e inquietudes, pero mi médico me brindó los recursos y la información que necesitaba para tomar la decisión correcta para mí y el bebé que traía en mi vientre. Y sí, fui vacunada contra el virus COVID-19 durante mi embarazo de mi segundo hijo y para serles sincero, eso fue la mejor decisión que pude haber hecho. Yo sabía qué tan mortal podría ser infectarse con el virus COVID-19 sin la protección de la vacuna. Personalmente perdí miembros de familia debido a este virus y por eso hice una prioridad a protegerme a mí y a mis hijos al vacunarnos. Por eso te invito a ti a que te vacunes. No esperes más, protégete, protege a tu familia, vacúnate contra el virus COVID-19.
Hola, mi nombre es Kimberly Choca y soy miembro de Food Action y quisiera invitarlos a que se vacunen contra el COVID-19. Durante mi embarazo y después del embarazo decidí ponerme la vacuna del COVID-19 y sus refuerzos. También decidí en ponerle la vacuna a mi bebé. Tanto él como yo estamos saludables, así que no teman y no duden en ponérsela. Gracias.
Hi, my name is Tanake, and I will be briefly sharing my experience about the COVID-19 vaccine while I was pregnant. Now, I decided to take the vaccine because I knew that I would get some protection for myself and for my baby while I was pregnant. And I remember asking my midwife about taking the vaccine, and she told me that at the time there was not much studies about the vaccine and pregnant women, but taking the vaccine would give me a much greater protection for myself and for my baby. Now, in December of 2021, closer to the ending of my pregnancy, about 3 to 4 weeks before I gave birth, I decided to take my first dose of the COVID-19 vaccine. And then in January 2022, after I gave birth, I took my second dose. Now, I must say that after taking both doses of the vaccine, I remember I did not have any symptoms or reaction to the vaccine at all. I know that there are some people that react to it and everybody experiences different, but for me, I did not have any reaction to the vaccine at all. The only symptoms I experienced was I had a sore arm or a little bit of swollen arm for just about a couple hours, and after that it reduces. And so my advice to any woman or pregnant woman that is looking to take the vaccine or that is just a little bit hesitant in taking the vaccine, I would encourage you to take the vaccine Why? Because it will give you some protection from COVID, not only for you, but for your baby as well. At least for the first 6 months of their life, they're able to be protected from COVID-19 because of you taking the vaccine. And so that would be my encouragement to any pregnant woman.
That is great. So now moving forward, we are going to go into our Q&A session. And I have questions for you, Dr. Clare. So the panel publics submitted some questions. And the first question is that you discussed the importance of the Tdap vaccine and the protection it provides against whooping cough. Should other family members be vaccinated if they're going to take care of the baby?
That's an excellent question. And I definitely recommend to my patients that their family members that are going to be either taking care of the baby or even visiting the baby and yourself should be vaccinated against DTaP and flu and COVID. Before we even knew about the COVID vaccination years ago, we always definitely recommended flu and Tdap. Because as we mentioned, the baby is in its most vulnerable time. It doesn't make those antibodies that we talked about on its own. It won't be able to be vaccinated for somewhere between up to 6 months. So by having other individuals that can put your baby at risk of those severe complications that my colleague mentioned, you're protecting your whole family. You're protecting everyone that it's around you, everyone that's around your baby. So definitely they should be vaccinated against DTaP, they should be vaccinated against flu, and they should be vaccinated against COVID and boosted. Definitely.
Thank you. What advice do you have for people who want to help others feel confident in receiving vaccines during their pregnancy or while postpartum?
That's a great question. You know, I've spoken to a lot of my patients over the last 3 years about feeling confident about getting vaccinated. And I love that term. I never use the term hesitancy. I love getting confident in getting vaccinated because people have many questions about, is it right for them? Is it safe? What should I do? I plan to breastfeed. And so speaking to your healthcare professional, your midwife, your obstetrician, your doctor helps in answering those questions so you can develop that confidence. Attending these panels are very important to get the information you need so you can make the best decision that's right for you and that's right for your family. If you choose not to get vaccinated, which I highly, highly recommend, we're all recommending that you do, you should still continue those protections that are still in place. So continuing to wear your mask, even though a lot of the mandates have been removed, a lot of changes have happened, you, especially during your pregnancy, as you're deciding, should continue to wear your mask, should continue to exercise those safety measures, which not only protect you against COVID, also have done a lot. My colleague mentioned how low the rates of flu were because everyone is masking at the time. So especially until you're making that decision that's right for you, still wear your mask, but we highly recommend to do so. And ask all the questions that you can. I've spoken to my patients when they have concerns to address that specific question. Some of my patients have been worried that, you know, are there harms because of how the vaccination started? Are there concerns about any side effects? Are they worried about, you know, they plan to breastfeed? What can happen? What about, they're not pregnant now, but want to become pregnant in the future? All of those questions I answer specifically so that I can help them make the right decision for them. And the other thing I want to mention is my specialty society has given me information as an obstetrician about how to speak to patients. We learn the tools, the information that we need to counsel our patients to make these decisions, which we do in many different things, but especially now when this information, is uncertain for many individuals. My colleague mentioned the rates of vaccination in pregnant persons is still extremely, extremely low. For certain groups, even lower. For example, for Black birthing persons, the rate is about 15% or so of vaccination, at least as of a year ago. The data may be changed now. So we know it's still important to not only get your 2 doses, but also to get boosted, because we know people have still been uncertain about getting the booster. So I still talk to my patients about, yes, I'm so happy you've gotten your 2 doses. Let's move ahead and also get boosted. Those are very important conversations to have. And I don't know if my colleague wanted to add anything else.
No, that's great.
You're muted now.
Sorry about that. Thank you. And the next question we have is, are there any pregnancy postpartum programs that you recommend for individuals who want to learn more on this topic?
Yes,
You're muted.
Unmute. Thank you. I direct my patients to a website if they have access to a computer, and I'll put it in the chat. This information is from the American College of Obstetricians and Gynecologists. It has information on a public-facing website. So in other words, a website for patients, not for doctors, that they can go to find out a lot of information about what to do. There's a whole part of the page that's dedicated to COVID-19, that's dedicated to vaccination. I'll put it in the chat for people to see, so that they can go to that site to get a lot more information. That's very, very helpful. I don't get not $1, not 1 cent if you go to this website, but I do send a lot of my patients to the website because it has information that is straightforward, not very, not for doctors, not for scientists, just for individuals, for patients to get their questions answered. And I'll put it in the chat for everybody.
Thank you so much, and that's really helpful. The last question that we have for you, Dr. Clare, is that, are there any contradictions for pregnancy and vaccination?
Oh, so we talked about in particular the 2 vaccines that we don't give to pregnant persons during their pregnancy. One is against measles, mumps, and rubella, and the other one is against chickenpox. So those are the vaccines because of how they're made. They're called live vaccines that we do not give to pregnant persons. Because of that, we wait after pregnancy to give those 2 types. Measles, mumps, and rubella, and the chickenpox, it's called varicella. Those are the 2 that are contraindicated, or in other words, not safe to give during the time of pregnancy because of the type of vaccines they are. But after you deliver, that's the time to get those 2. And then the other ones that we talked about today, again, emphasizing the same message: flu, DTaP, COVID, safe to take during any time of the pregnancy, except for DTaP. We talked about DTaP, 27 to 36 weeks. Flu, COVID, anytime during your pregnancy. I just want to be clear about that.
Thank you. That definitely helps. Moving forward to Dr. Teasdale, and we do have some questions for you as well. There is a lot of misinformation out there that has spread rumors about COVID-19 vaccine and infertility or miscarriage. What would we tell your audience to help put these rumors to rest?
Sure, good question. So I'll explain it first and then talk a bit about misinformation, because there's a lot out there. So in general, there's no reason to believe the way these vaccines work would impact fertility. But mostly the evidence we have is that there's no indication that there's an effect of the vaccines on fertility or on outcomes for pregnant people. So the way we know that is the way vaccines always start in terms of being studied is they're studied in animals first, and that gives a very strong signal if something is harmful to fetuses, to pregnant animals. That is or we can look at fertility as well, right? And all of that is tested. There was no indication for these vaccines that there was any harm. And then the trials move into people and the safety is tested. And while the initial clinical trials for the COVID-19 vaccine were not conducted in pregnant people, were not in those trials, although there were some people who ended up getting pregnant in those trials. There has been a trial since that was looking at the safety and effectiveness of the COVID-19 vaccine in pregnant women and pregnant people. And that has also found that the vaccine is safe. So those are the studies. And then we have all of our what's called surveillance data, right? Where we're constantly monitoring to see, is there any indication that this is dangerous? And this is done through what's called the Vaccine Adverse Event Reporting System, or VAERS. And then we also have the CDC is following more than 23,000 pregnant people in the US after vaccination, during breastfeeding, during the first year of their infants' lives, to see about side effects, to find out how people are feeling. And again, so far, they're having the same general side effects of sore arms and things like that. And there's no indication that there is any danger, okay? So that's what the science tells us. The problem is there's all this misinformation, right? And so I think what we would say, and Dr. Clare can add here too, is that you want to be careful about your sources of information. And social media can be great. You can get linked to really good data. But you can also get linked to really bad data. And unfortunately, some of that misinformation, right, which just means something that's inaccurate or wrong or incorrect, is actually deliberately being put out there. Right? It's being deliberately put out there to deceive people. And in particular, this story about infertility, it's not new. We've heard this story with other vaccines. This is something that's put out to scare people because it is scary. That's a scary idea that something could affect your fertility or the fertility of your children. But in this case, it's not true. And for other vaccines, it's also not true. So really be careful about where you're getting your information. And the best places to get information are from medical centers, from the CDC, from other government or state resources, or a trusted source like Hunger Free New York. Those are good sources. Things you find on Facebook, on Instagram, really want to be careful.
If I could just add one thing to Professor Tinsdale's comments. In terms of the fertility question, what they did do is that they looked at studies in individuals that were attempting fertility treatments to look at their outcomes. And they compared those individuals that were vaccinated at the time. And they found that there was no difference in those individuals in terms of their outcomes in trying to get pregnant. So that's how we know about the safety of the people that specifically have issues with fertility. No difference in their ability to get pregnant, no poor outcomes to those developing babies that were happening at the time of getting pregnant. So that's how we know about fertility. So that's been extremely well studied, as my colleague mentioned. So we have an answer to that. Now, in individuals that are male partners who get the COVID-19 infection, not vaccinated, but the infection, those male partners have been shown to have some issues with ejaculation or with semen quality and things like that. So those are people that are male partners who have not been vaccinated and have had COVID-19 infection. So really important when you're looking at social media, when you're looking at the data, who are they exactly talking about? What groups of individuals are they talking about? And luckily for several of my colleagues, physicians who were pregnant around the time when the vaccine came out, those are the individuals that we really learned from. These were people that were working front lines that got vaccinated very, very early on in 2021, that we got this safety information from, even though we didn't have pregnant persons in the original clinical trials. That's where all those numbers are coming from. These were pregnant doctors, pregnant scientists who made those decisions and got vaccinated themselves. And that's where we get that data from about those individuals. So thanks for me jumping in.
Thank you. Thank you, Dr. Clare and Dr. Teasdale, for your time and efforts in addressing the concerns of our community members. We really appreciate it. In closing, we want to say thank you to HARE for participating today. We are so grateful for your time and hope you do take the advantage of all the resources that we shared with you in this evening. A recording of this webinar will also be available shortly in English and in Spanish. On behalf of the Vaccine Literacy Campaign, the CUNY School of Public Health, and Hunger Free NYC, thank you all so much for all the time and have a wonderful rest of your night.